Hi everyone, today I'll be talking about renal replacement therapy. To those who have been diagnosed with acute kidney injury, chronic kidney disease, or end-stage renal disease, and you are not having the privilege to have kidney transplant yet, or you are waiting, or at your jurisdiction that procedure could not be done, or you are not willing, or you are a healthcare provider and you are dealing with any of those three diagnoses, you can practice or adopt renal replacement therapy. So, having that at the back of our mind, let's go. Renal replacement therapy restores the blood filtering function of the kidney in the face of acute kidney injury or chronic kidney disease or even end-stage renal disease. Renal replacement therapy, like I've earlier said, could be used in the face of acute kidney injury or chronic kidney disease, and the assessment of the renal function should be determined using estimated glomerular filtration rate. The values of estimated glomerular filtration rate would depict the degree of renal impairment, the progression, and the response to therapy. We can also use urinalysis for proteinuria, hematuria, cellular cast, and all will be useful. In addition to that, we can make use of kidney, urethra, and bladder ultrasonography. You can refer, instead of embarking on renal replacement therapy, you can refer if you are faced with rapid declining in function of the renal system, or you are dealing with albumin to kidney ratio greater than 300 mg per gram, or you are having loss of urinary red blood cell cast, please refer to nephrologist. Okay, to make use of renal replacement therapy, we have to make a definitive diagnosis as per what exactly are we dealing with. Is this acute kidney injury? Are we dealing with chronic kidney disease? Or are we already at the phase of end-stage renal disease? We need to make that specific diagnosis. And that will include ruling out all reversible causes. Why that? When you are able to identify reversible cause or causes, then you'll be able to treat, and then we will not need replacement therapy. But if you've ruled out all reversible causes and you think the next thing is renal replacement therapy, then we have to embark on renal replacement therapy early enough. We will embark on that while waiting for kidney transplant. Or the patient is not willing to have kidney transplant, then start renal replacement therapy immediately. Or the procedure, that is kidney transplant, cannot be done on timely basis in your jurisdiction, start renal replacement therapy today. Renal replacement therapy could be hemodialysis, peritoneal dialysis, hemofiltration, hemodiafiltration, and of course the definitive one is kidney transplantation. The different types are continuous renal replacement therapy or intermittent renal replacement therapy. You can use certain routes like AV, which means it lives through an artery and returns via a vein, or lives through a vein and returns via a vein. So it's either the AV arteriovenous or the VV venovenous. An example is IVV-HD, which means intermittent venovenous hemodialysis. Remember, I've mentioned earlier that it could be continuous or intermittent replacement therapy. And another example is CAVHD, that is continuous arteriovenous hemodialysis. Renal replacement therapy may not cure. Renal replacement therapy may not cure the chronic kidney disease or the end-stage renal disease, but can improve the status and prolong the life of the affected person. With good response to renal replacement therapy, there can be relatively good kidney function, and it should be introduced early. Remember, I am bringing this point again for the second time, that is early introduction. So, whenever we are faced with the choice of adopting or embarking upon renal replacement therapy, please let's start that early enough. And with that, I've come to the end of this short presentation. Kindly remember to share and subscribe. I appreciate it.